Welcome to the office. Hi, Anna.
Hello.
Welcome back.
Thank you.
It's been about a week.
Yeah, it's been a week.
Yeah, what's going on?
Right now, I really want to crack my back.
Why you want to crack your back?
I feel like there's this tension building up and like between my shoulder blades.
Stand up, turn around, show me.
It's like more on the left side over here.
So you feel like cracking there?
Yeah, like right here.
How are you gonna crack it?
Probably like take my arm and go like.
Okay, so let's let her crack. I'm gonna actually let her crack it. I'm gonna show you something though.
Okay.
We're gonna test something before we continue. This is interesting.
I don't know if I can get it though, but yeah.
But you feel like cracking it.
Yeah.
I'm just gonna scope real quick, just that area.
Uh-huh.
And I'm gonna let you attempt it.
Okay.
Okay, hold on. Come over here. Come here, I want you to see this.
Recently, I haven't been wanting to crack my back.
Oh, look, she got a pimple right there.
Oh, that's
You
funny.
see that? That's new. Now, we talk about this even in a lot of my older videos. When there's a pimple on the spine that wasn't there before, that's a subluxation stop sign. And look, we got pressure right there. Interesting.
That's funny.
It's not funny, it's real. All right, so we have pressure, T4 area. All right. Now, what do you want to do? How would you do it? I'm curious.
Normally,
We got a lot of self-crackers out there. So tell me, how would you like to do it?
Normally, I try like any way I can until it gets out. So, like sometimes it would be like this to get the shoulder.
Do it. Do what you gotta do.
I just
Come,
did
come.
like this.
Did it do it?
Yeah, to get the shoulders out, and then for the back area, maybe like.
Now, here's what's interesting. She thinks she gave herself an adjustment, and you guys think that sound is like, oh my God, you think that's what you pay for.
It does sound different. It sounds more shallow compared to when you do it. It's like more like bubbly.
So let's go with that. So when you do it, it's a higher pitch.
Yeah, it's like
It's
lighter.
the crackly sounds, right?
Yeah, and like, or there's the other way that I crack that does try to get it deeper. I haven't done it in a while as much so, but this is where I go like, oh, I can't get it right now. I think I got most of it out earlier. Oh, there it is.
You crazy girl. She came to my office and just cracked everything in her body. Now, let's go with that, okay? Let's go with that. There's a good theme here. So the theme is, let's just, I've had people say, just crack me like a glow stick, doc. Or just crack everything in the body. I think you just cracked your whole spine.
Yeah, it feels like it. I
Most
got
of
like
it.
the upper and like the lower as well.
Okay, so sorry, go on.
Or yeah, that's why I often cracked my back a lot, because it would relieve that pressure. But yeah, I haven't had to crack like that the whole entire thing for quite a while, for quite a few months now.
Okay.
But right
what
now, it's
happened?
just like the upper spine. And
What
also,
happened this week? Activities, posture. Because I need to actually talk about that. What that is, guys, is this. That's just, okay, so people will say, what's the sound? It's gas being released from the joints. Sure. It's also ligamentous, okay? And what do I mean by that? So we know that you have some curvature stuff going on, right? And I'm talking more of the lateral curves. So in your scenario, this is ideal, right? We want to have our ideal curves. I'm just giving an example. This is ideal, right? 40 to 60, 60, 60. Ligaments, muscles are all balanced. Yours is more straight, right?
Yeah.
So these ligaments and muscles are they're working differently. And when you're sitting for a period of time,
it gets tiring.
Stanford did the study. They found the body will acquire the position it's most in within a 5 to 10 year period. Now, what does that mean? Let's say you're like this for a period of time, that becomes the reality. So everything is in this position. Now, as you start to move around, they're still in that position. So when you're popping or moving, you're trying to go back to normal. You're trying to go back. So you're putting a curve in the spine and then twisting where you don't have the normal curve at the moment. And that's what we're working on. Does that make sense?
Yeah.
So when you're self-cracking and doing just this and this, She didn't thrust into it. You didn't like do that. You just stretched.
Yeah.
So if stretches causes if stretching causes popping, it's a posture issue.
Okay.
They're all going to be like, what is he talking about? Okay. How's the jaw?
The jaw's been good. When I close, it's a little easier. Like, I normally don't have to use my hand anymore.
So this week you didn't have to use your hand to close your mouth?
Yeah, but when I open, there's still a little bit of locking. But closing, it's easier when I purposely bring my chin back a little bit.
Got it. Okay.
Yeah.
All right. You ready for more?
Yeah.
Anything else you want to share?
There was something earlier. What was it? I forgot.
No problem.
I think we're good. Yeah.
It's been an interesting journey so far, right?
Yeah. Oh, I've been experimenting with my sleep a lot, actually.
Tell me.
So I was working, for my senior thesis, I was working on a sleep circadian rhythm regulation system.
Okay.
Regulating your life.
Is that a program? Is that a physical device?
Multiple devices working together
Okay.
in a home system and wearables included.
Nice.
And I was doing a lot of sleep research, and while doing all the sleep neuroscience research, I started to suspect that for myself, I might be in terms of sleep chronotypes, I might be a super early morning chronotype person.
Okay.
I always thought I was a night owl, which is why it was easy for me to pull all-nighters without caffeine pretty often. But now I'm starting to realize, my body naturally wants to sleep between 8 p.m. and 4 a.m.
Perfect.
So I've been waking up at 4 a.m. I know there's a whole social media trend right now with that too.
The ambrosial hour.
Yeah, but it's surprisingly working really well for me. It's easier for me to get out of bed at 4 or 5 a.m. versus 11 a.m. At 11 a.m., it'll take me 2 hours, even if it's the same amount of sleep.
Yeah, there was a study came out years ago, and I don't know where it is, but I just remember hearing it years ago, and they said you should sleep by 12 a.m. latest for that day. For every minute past 12 a.m. in that day is like your body loses an hour of sleep. Oh. It was a long time ago. It was 20 years ago, and the idea was that it throws off your circadian rhythm, right? So you want to follow circadian rhythm. Yeah. That's pretty interesting.
Yeah, so right now I'm trying to adjust my circadian rhythm according to my genetic chronotype.
Okay.
And I have noticed too, it runs in my family. My grandma she sleeps from 7 p.m. to 4 a.m. too. I thought that was just because she's old, but now I'm realizing that might be genetic.
It could be genetic, it could be something else, but there's a big thing about the ambrosial hour between 3 and 5 a.m. You guys can look it up yourselves, but I get up at that time, between that time, since I was in grade 3.
Oh, wow.
That's my meditation time.
Wow, yeah, it's helped me a lot with just energy levels in general, because before, along with my depression, is just completely bedridden. Yeah. Nearly all day, but now it's it's so easy to get out of bed.
Good. Yeah. Awesome. And you're letting go of some stuff since we started?
Yeah, I think so.
Or you're more aware of it?
I think more aware.
Okay.
Yeah.
All right. You ready to get started?
Yeah.
You ready for more?
Yeah.
Let's do it. Starting at the base of the neck. Are you getting some of your answers since you started here?
I think so.
Okay. Fair enough. C6, 5 points, left side. C1, right side, 5 points. T4, 5 points, left side. So if she cracked everything, there should be no pressure here, right?
There's still a little.
No, I'm saying though, if the amount of cracking you did, and this is the thing, the crack isn't clearing pressure, guys.
Yeah, that's why I became a chronic cracker.
We're down in the tailbone, S4, S5, T4, and upper cervical, okay? Let's check the hips, feet together, open and close your knees, open and close. Right side only, please. Left side only. Good. Come back slow. Come back slowly towards me. That's 5. That's 1. That's 2. That's 3. I'm getting it at 4. Tender at 4 or 5?
5.
So, okay. That's 4. Nope, still 5.
Yeah.
Yep. Okay. Let's check the upper part, please. Head down.
Oh.
1, 2, 3, 4. It's actually, that's 5. That's 4. More tender at 5 or 4?
5 a little bit more.
Not 6.
No. Yeah,
Right,
5.
5. T5, S5. Ooh. Let's check up top. Sit back for me, please, all the way. We're going to do S5, actually. I was hoping to get to the upper, but we're not there yet, dude. I was hoping to get to the upper lumbars, but we're not there. Bend right, bend left. See 6 on the left. See 1 on the right. 2 is fine. Look straight ahead. Slowly open, open, close. It is easier. Cool. Walk it off once and we'll get started.
Okay.
You ready for me?
Uh-huh.
Yeah?
Yeah.
Right side, sorry, left side down over here, please. So we talked a little bit about life. And just letting go of stuff, right? And things that we're holding in the body.
Yeah.
And this is part of Anna's journey, is letting go of certain things and programs that we inherit. We all have them. We all have them, guys. And there was a couple of great books I put out there for people to read. Power of Now, Eckhart Tolle. He's actually here in LA. My cousin's going to it. And learning about the pain body and about emotional pain from the past manifesting in the present. Then there's another book by Dr. Maxwell Maltz, The New Psycho-Cybernetics, learning about the image issue. He talks about several mechanisms and image issues that we all have. And those are also programs we inherit from very young. And the third book is The Big Leap by Gay Hendrickson, which is also talking about programs. And, you know, we want to be in our genius zone, but we have 4 main reasons that limit us that also come from early programs, and we all have it. And as I mentioned to you and a lot of patients, by the time I realized all this stuff, it took me 7 years to go through that process. And so it's the journey, guys. It's the process, you know. There's no quick this, that. There's no magic pill that anyone's going to give you. There's no magic adjustment. Well, there is a few magic adjustments, but generally speaking, right? I just wanted to share that with everybody. Relax there. Nope, come over here, face down. Alrighty. There you go. Let's go face down, please. Slide up a little more. There. Gotcha. Shoulders down. One, two, three, four, 5. Perfect. That's the whole one. All right, let's come on in. And I'd like you to go right side down, okay? And get a tiny bit more right side down. There you go. Bottom leg straight. That's the rest. Walk it off. This one's light, 6. And she's got a long neck, meaning you got to stabilize it and lock it out. But that was a high-pitched sound, right?
Mm-hmm.
We don't like high pitch. So let's see if we can get a little more. Don't help, please. That's the rest. That's it. Okay. Walk it off one more time and come back, and then we'll check up top. So what are you doing with all your free time now?
I'm still attending a program.
Okay.
Yeah, and then so that takes up most of my days, and then just trying to regulate my circadian rhythms, I guess.
Regulating the nervous system.
Yeah, nervous system. Yeah, so like taking walks outside.
Can I teach you something really cool?
Yeah.
It actually works. So if you want to, it's part of circadian rhythm. If you want to increase your energy, you want to increase adrenal function, watch a sunrise barefoot on the wet grass. Stimulates kidneys, stimulates adrenals. You're watching the first 20 minutes of a sunrise. If you want to calm down, you need to down-regulate. Watch the last 20 minutes of a sunset.
I did learn about these, but in a different sense.
It really, really works.
Wow.
Let's do C.
Cool.
Perfect. Okay, let's check the mouth. Slowly open, 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 close. Open all the way. Close half, hold. I'm pushing right to left. 4, 3, 2, 1. Open. Open all the way. Close. Close. There you go. Close. Good. This one's going to be a lighter one today. You okay?
Yeah.
Head back. Actually, let's bring it forward. Sit straight. There you go. Open the mouth. And then go just light in there. It's there, but it's less. 5, 4, 3, 2. And this is which side of what energetically, it's what side? Right side is male side, career side. That's not where we're going to find it. Let's go on this side. Go on the left side. Head back, head back. There it is. 5, 4, 3. Head back, head back. There you go. 3, 2. 4, 3, 2. Okay. Okay. How's everything else going, Anna?
Like physically or
Physically, overall?
everything else? I think it's good.
And you said you're getting your walks in. You got to the beach?
No, not yet.
Today,
Because-
please. You have time? Go, please.
Okay.
Please go walk in the wet sand.
Okay.
Or think about what we talked about, the circadian rhythm.
But it's been raining recently, so the
On your
water's
back.
dirty.
On your back. That's true, actually.
Ouch. Right side.
Right ankle. left knee. Got to get that fear out.
Ow.
Relax the knee. There you go. Awesome.
Why not the right knee?
Because I saw the left.
Huh.
It's the left knee.
Oh.
Right knee's okay. Stand up. Good question, though. Stand up, walk it out, check it out. One more time. Cool. Any questions for me?
So don't crack like that on my own.
Well, we cleared you, right?
Yeah.
Now here's what's going to be.
I guess I don't need to anymore. I don't feel the need.
We're going to try something, though.
Hopefully.
Have a seat. Let's rescope. Let's make sure everything is clear. We're going to try something right now, guys. This is something new. I've never actually done this before with anybody.
Uh-oh.
Neck is clear. 4 is clear. Sit up straight. Tailbone is clear. Okay, so you're clear, all right? And you cracked all that stuff in the beginning.
Yeah.
Okay, stand up for me, please. Let me just close you up back here. See if you can do that again, the cracking.
Well, normally it takes a while for the cracks to like rebuild up.
Correct. But
Yeah.
let's just see if anything is crackable.
No, I don't think so.
Okay.
Yeah, no.
All good, right?
Uh-huh.
Okay. We're gonna try something next time.
Uh-huh.
Okay, we'll leave it at that for today.
Okay.
We'll leave it at that. Stand up, squeeze. The lesson today was cracking, making sound didn't clear pressure in your spine.
Yeah.
It needed a very specific adjustment.
Uh-huh.
That was one of the lessons today. Second lesson is we hold a lot of stuff in our body.
Uh-huh.
Third lesson is we need to let go of stuff. Fourth lesson is we need to learn more neuroscience.
Oh, yeah.
I'm just kidding. Squeeze. You're all good. Okay? I will see you in about a week.
Okay.
All right?
Yeah.
Enjoy your journey.
Thank you.
Anything else you want to share?
No.
Okay. Cool. Take care.